What do you hope to see from the healthcare industry to really expand access to virtual maternal fetal medicine?
That's a great question. I mean, I guess broadly, I hope they just expand it, expand it to the hilt. I think we're seeing that, our virtual MFM care has the greatest impact in rural areas. We know that nearly half of like rural U.S. counties are maternity care deserts. We know that a lack of providers and limited access to high level of care translates to significantly worse pregnancy outcomes. And the trickle down effect of that, of course, is increasing numbers of, in its worst form, increasing numbers of maternal death. The investments that we're making are great. I think, a lot of buzz has been talked about the Rural Health Transformation Fund and the Rural Health Transformation Program. Definitely a step in the right direction, but I still think absolutely we need more to be done to improve access to care for our rural patients. Of course, we know that women, cross-cultural trends are that women are delaying childbearing, and women over 40 experience, worse pregnancy and delivery complications at a higher rate. And of course, the need for our subspecialty to get into those areas is only growing. But there are very few practicing MFMs compared to other specialties, and most of them work in the large metropolitan areas. So we'll need to continue to adopt strategies that get MFMs into rural communities, smaller hospitals, smaller to medium-sized hospitals. Telehealth just happens to be a great lever to pull on to get subspecialty care where it needs to go, regardless of zip code. We also know that a key kind of critical function of ensuring that we keep our labor and deliveries open at rural centers is supporting the OBGYNs. And access to subspecialty backup is a significant part of kind of attracting and retaining OBGYN physicians to keep their rural labor and deliveries functional, to keep deliveries happening locally. And then, of course, obviously, we not only support the OBs so that hospitals can attract and retain them, but also keeping the transfers as low as reasonably possible so that those rural healthcare systems are vibrant and financially stable. So really, there's several different ways that we see ourselves kind of supporting the need and the growing need for our rural healthcare systems to be kind of vibrant and stable. And it's exciting that we have things like the Rural Health Transformation Fund that are going to continue these investments. We, of course, just look forward to partnering with states and local healthcare systems as more of this comes online and more of this becomes available about how this will work, making sure that they have access to, a great group of physicians, a great service, and so that we can continue those investments in rural healthcare.